Dr. Buzz, we were discussing the Dutch test and adrenal test, and one of the comments was, why isn't this a regular thing that's being checked? So, why don't clinics or doctors check these things on the normal?
That's a great question. I would agree with the thought process on that. Typically, when you go to your doctor, they're going to do blood work, and blood work is fine. But I always explain to people, blood work's kind of like the check engine light on your car. It'll tell you kind of at the end stage what's something's wrong, but it doesn't help you diagnose what the root cause is. So then when you have a check engine light on your car, you go to the mechanic, and what's the mechanic do?
Hmm.
He plugs it into a scanner and digs deeper, and that's what these other tests like adrenal tests, organic acid test, DNA stool analysis. Those are deeper tests to get to the root cause.
Yep.
And unfortunately, insurance only covers things that are catastrophic in nature. So when you have a heart attack, insurance covers it, but it's not going to pay for you to take, CoQ10 or take vitamins to help prevent heart attack, if that makes sense.
Yes.
I always say all insurance works the same way, like car insurance. We all have car insurance, at least we're supposed to. And if you hit a tree with your car, your insurance covers it.
Hmm.
But if your tires are bald, your insurance doesn't cover it because that's considered maintenance.
Right.
These tests are tests to maintain your health before things become catastrophic. So unfortunately, they're not covered.
Yeah. That sucks.
Yeah.
All right. Thank you for that. Dr. Buzz, can A2M injections work in the CMC joint?
Yeah. So A2M, remember the mechanism, how it works is the reason people develop arthritis is a joint is exposed to some type of trauma, whether it's a sports injury, maybe a post surgery. And when that joint is exposed to some type of trauma, your body releases these proteins called proteases into the area, and they serve a good purpose there. They're to clean up the damage.
Mm-hmm.
Where it becomes problematic is as we age, our joints become avascular. When I say age, between 30 and 35 years of age, right around there, they become avascular. And those proteases, which are large proteins, once they're released, they get trapped in the joint. And then once they're done cleaning up whatever there is left to clean up, they're stuck in the joint, and they're like termites stuck in the joint. If there's nothing left to clean up, then they start to eat away at the synovial fluid and the cartilage.
Mm-hmm.
So the question is, will A2M help the CMC joint? A2M can be put into any joint capsule. Now, you don't put A2M into a muscle belly to like for a torn rotator cuff or a torn bicep tendon because that's not a joint capsule because proteases don't get trapped there. Proteases get trapped inside a capsule. So any joint that contains a capsule would benefit from A2M.
Dr. Buzz, anything on bone spurs for a joint?
Yeah, so bone spurs are caused from proteases being trapped in the joint for a long period of time in the joint. It's literally at this point here, they're eating away at the bone, which causes bone spurs. We see that quite often in the clinic. Um, if you have bone spurs, you have two ways you can get rid of them. There's no treatment that can get rid of bone spurs, but that doesn't mean they have to cause pain. Often, what you see is a joint is compressed and it's causing the bone spurs to rub or pinch on something because there's also no synovial fluid in there too. So I know, like for back, a lot of times someone will come in and there'll be bone on bone. With your bone on bone, you wouldn't be in our office, but there'll be very compromised space and some bone spurs causing discomfort. And if you do something like decompression therapy that helps rehydrate that and gets the bone spurs off, I've seen really good results.
Okay.
And the same thing with shoulders and, putting some A2M in the shoulder to get rid of the proteases so the synovial fluid restores itself and you grow some more cartilage back. You can't get rid of the bone spurs, but if you can create more joint space, you can take away the pain or discomfort of the bone spurs very often.
Dr. Buzz, so 18 months post ACL, what should I do to prevent arthritis?
Yeah, great question. So, if you had an ACL surgery, number one, I would say if you're below 30, you probably don't have to do anything. You're probably good to go, especially if you don't have any pain, because the trauma of the surgery would cause you to release proteases, but your joint's probably still vascular, and those proteases are going to cycle right out, and you're good to go. The issue is once you get past 30 to 35 years of age and you have a surgery like an ACL or a meniscus, you are going to have to deal with some proteases that are going to be trapped in that joint. And although you might not have symptoms now, if you don't get those proteases out of the joint, long term, you'll end up with arthritis. And the vast majority of people we treat in our clinic that have, in particular with knees, real severe knee arthritis, you do their history, and they had a knee surgery, a meniscus, and ACL 5 or 10 years ago, and those proteases have eaten away at the joint. So, what I would recommend in a situation like that is using A2M, which is a product we make out of their own blood. A2M stands for alpha 2 macroglobulin, which is a broad based protease inhibitor. If you put that in there, it will remove the proteases in there that will lead to the long term arthritis. And I would say do that before it becomes a problem, because usually by the time you have pain, it's progressed pretty far along.
Mhm.
So I always recommend anyone who's had any type of joint surgery in their past 30 to 35 years of age, definitely use A2M as soon as you can afterwards, just to clear that joint out and make sure none of those damaging proteases are stuck in that joint.
Dr. Buzz, what is the difference between A2M and PRP?
Okay. Great question. They're both made out of blood. That's really all they have in common.
Mhm.
PRP is you take a person's blood and you concentrate down the platelets and growth factors, think of them as fertilizers, and then you inject that into an area and it helps that area become more anabolic so it heals. So, like putting fertilizer in your garden. A2M is also made out of your blood, but it's a totally different molecule. It stands for alpha 2 macroglobulin. And that product there is a broad based protease inhibitor, which
Mhm.
means it stops arthritis. So, but it's not anabolic, but it gets rid of the thing that causes the arthritis and degeneration. So, just totally different products. If you have arthritis, A2M is a far superior product because it's the only thing that stops arthritis at the molecular level. If you have a tendonitis or a partially torn muscle, then PRP would be the right choice, things outside of the joint capsule.
Dr. Buzz, is push patch made just for men?
Nope, that's why it is tan in color. If it was just for men, we'd have cool men colors.
Love
No, they work
that.
equally well on males and females, so it's
Made for
sex
everyone.
doesn't matter.
Okay. Dr. Buzz, since BPC 157 isn't FDA approved, do you have any clinical testing to support your patch's work?
Yeah, I mean, there's lots of things that aren't FDA approved that work. Epidurals, which are done, millions are done in America every year, aren't FDA approved yet. They're very effective for people to get rid of back pain. So just because something's approved or not approved really has nothing to do with the efficacy of it. And opioids are FDA approved and are those good for you.
Right?
So I wouldn't use that to judge if something's good or not good. There's hundreds of studies out there on the efficacy of BPC 157.
Yep.
So so just Google search BPC 157 for whatever condition. You'll find there's lots of good clinical stuff out there. Um, but the FDA approval really has nothing to do with the efficacy of it whatsoever. So I would not use that as my judge. Obviously, the product we use, we have full testing on all the product to prove the purity, third party testing. Um, there's lots of people out there making BPC. Unfortunately, a lot of it comes from China. What you do have to keep in mind with peptides is the way they're manufactured are very solvent based. So if you're going to buy some BPC, I would definitely recommend get it from somebody who has third party testing and try to get something that's been made here in the USA.
Dr. Buzz, can you wear a push patch when breastfeeding?
Yeah, that's a great question. So um, that's one that I think would be of benefit, but I also think that you would need to get approval from your pediatrician because if something would happen, which I don't know what would happen, because you got to keep in mind whether it's BPC, NAD, glutathione, you already have these in your body. You're just supplementing and giving your body more. There's nothing that with the push patch that's new or foreign to your body. It's not like we're taking a drug.
Mhm.
But that being said, anytime you're dealing with something that and a baby's involved, I would get pediatric approval.
Dr. Buzz, does the push patch help through postpartum?
And postpartum is pretty interesting. A lot of postpartum has to do with hormonal issues. We get really good results, and because a lot of that has to do with mitochondrial dysfunction.
Mhm.
So the NAD patch definitely helps with mood and energy levels. So if you're suffering with postpartum, I would definitely give the NAD a try because remember the NAD. Basically, what happens is what you got to keep in mind is NAD stimulates the mitochondria, which the simplest way to think of the mitochondria, it's the batteries that make your cell work. Um, Having a baby is very traumatic and can wear those batteries down. So taking NAD and putting those batteries on a recharger is definitely going to be a benefit.
Dr. Buzz, can I wear push patch and take other supplements or medications at the same time?
Yeah, there's no contraindications to wearing push patch with any other medications. The only contraindications I would say is it is a medical device that has a very light electric current. So you would never want to wear the push patch on top of another electrical device. So if you have a pacemaker, don't put the push patch directly on top of your pacemaker. If you have a pain pump in your back, don't put it directly on top of your pain pump. You have to wear it away. Now, obviously, like with NAD, for example, really helps people that have weak hearts or weak ejection fraction. So I would strongly recommend wearing the NAD patch, but don't wear it on top of your pacemaker. Wear it on your arm or somewhere else so it doesn't interfere with the current from the pacemaker.
Dr. Buzz, where is push patch made?
Yeah, so all of the peptides and coenzymes used in push patch are compounded or made right here in the United States. That's very important. A lot of these peptides are imported from China, uh, and we actually tested quite a few of those. And what we found in our testing is the process of making peptides is very solvent based. Solvents are poisons. So if it's not done properly, they can be toxic in nature. And if you're doing something that's going to go into their bloodstream, you need to be careful. So that's why we've kind of brought that process in house, manufacture our own peptides. We're lucky enough to have a biochemist on our team. Um, so the answer is our peptides are made here in the US, but if you are buying peptides, I think, number one, you want to see third party testing to make sure they are what they say they are. Cause I kind of see all over TikTok and Facebook and Instagram, everyone's selling peptides now. I would want to see,
Amazon.
yeah, third party testing for sure, and make sure they're sourced here in the USA.
Dr. Buzz, what are all the different peptides I can get with push patch or use with a push patch?
Yeah, well, we have several different peptides and coenzymes. Um, so the peptides we have are KPV and BPC 157 and GHKCU. And then the coenzyme we have is going to be NAD plus.
Mhm.
And then glutathione is really considered a polypeptide. So those are the different combinations. But one thing you will see is the way peptides work is you have a peptide, but the peptide, when it goes to the cell, that cell needs energy or the peptide won't work. So you'll notice with all of our peptides are combined with NAD. Why do you do that? Well, if you give somebody who's sick or has mitochondrial damage, just like BPC 157, for example, but their cells don't have the energy to use it, the peptide goes to waste.
Mhm.
So all of our peptides are combined with NAD because you have the peptide and you have the NAD, which is the battery. So it actually works in the cell.
Dr. Buzz, how can someone order push patch?
Okay. So the push patch itself is a medical device.
Mhm.
So you can't go to Amazon and buy it, or you can't buy it on eBay or anything like that. And if anyone's trying to sell some type of patch like that on there, it's not going to work. You do need a driver to get the peptides into the bloodstream. So I've seen a couple companies out there that have like little stickers you can put on with NAD or other patches that don't use iontophoresis technology. Those won't work. They're a waste of money. Um, and then the other thing I remember with these peptides is NAD is not orally bioavailable. So if you're buying oral NAD, you're wasting your money. BPC absorption rate is about 10% orally. So you'd have to take 10 times the dosage of BPC orally to get the same effect as you would with iontophoresis or injection. And KPV is less than 10% absorption, and glutathione, once again, has almost zero absorption. So all of these peptides and coenzymes do need to be either use iontophoresis or injection or IV. As far as where you can get it, the iontophoresis device itself is a medical device, so you will need a prescription to get that. Um, Chiropractors can prescribe it, medical doctors, DOs, NPs, functional medicine providers, but it will need to be a licensed provider in your state to prescribe that because it is a true medical device.
Dr. Buzz, do you ship push patch to other countries?
Yeah, that's a great question. So we ship quite a lot. Kind of something I didn't realize is a lot of the Asian countries, the people there have a big aversion to needles.
Mm.
So we sell quite a few over there. The Middle East has been another hotbed. We send some to Europe also. Now, some of the countries is kind of different because they won't get through customs because they probably think there's some other type of drug. I don't know. So, but the answer is yes, we ship to other countries. There's no issue with us shipping to the country. The issue is will customs let it in?
Dr. Buzz, Can you please explain why you shake the peptide vial and if you're shaking it too hard or too fast or too slow, or what's the right shake?
That's a great question. I've been doing peptides for 10 plus years. And when I first started doing peptides, I was always told never shake it. And when you pour the water in there, you got to be really gentle because you'll break the peptides and they won't work. And Nick, our biochemist, when we first started working with him, we've been with him for years now. I kind of mentioned it to him and he laughed at me. And he's like, Buzz, it doesn't matter. You're not going to, like, they're not that delicate.
Oh,
So, and Nick's a nerd, you know that. So Nick even he's like, here's our mass spectrometer to prove that they don't get broken down. So what he found with his testing with mass spectrometry is whether you shake it hard or don't shake it hard, it doesn't matter. Now, I probably wouldn't put it in a blender, but you're not going to shake it hard enough in the vial to break the peptides down or make them not work. Now, what I will tell you is peptides are very light sensitive. So even in lyophilized form, it's very important you keep them out of direct sunlight. That's why we ship them in foil bags, and it's very important. And the other thing is once they're mixed, they break down quickly. So if you're buying peptides that are already pre-mixed with liquid, they're always going to be weaker. That's why we ship ours lyophilized and we have them mix them yourself. That's going to ensure the strength. And then once they're mixed or reconstituted with bacteriostatic water, it's very important that if you're not going to use it right away, that they are temperature sensitive also. So you got to keep it in a refrigerator. So to once again make things clear, no matter you're not going to shake it hard enough to mess up the peptides. Um, they're always light sensitive, so you want to keep peptides out of direct sunlight. And once they're mixed, you want to use them as quickly as possible afterwards. And if you're going to be storing them, you have to once they're mixed with saline or bacteriostatic water, you do have to keep them refrigerated.